this video, we are going to talk about something that is pretty common for women to experience after their explant surgery. It's called a detox flare. Hey, it's Christina, the founder of Size Happy and the admin of the best Facebook group on Facebook, Breast Implant Illness, Rejuvenation, and Education with Christina. And you can also find me on Instagram at I am Size Happy. I'll put the link down to my website and my group and my Instagram below in the description area. Great, so if you are embarking on a journey to discover what can I expect from an explant surgery, what's gonna happen afterwards, how might I feel, everything like that, or maybe you just had an explant and you've heard about something called a detox flare and you're wondering what is that? What can I do about that? Is there anything I should be avoiding, so on and so forth? Or maybe you're having a detox flare right now and you're just needing a little extra support. We're gonna cover what it is and what you can do if you're having one in this video. After your explant surgery, for most women, you will feel better. You're gonna notice that your energy is a little bit better, your brain fog is slightly lifted, and you're just gonna have this sense of relief of oh my God, this is finally done with. But then around anywhere from the 4-month mark on, you can experience something called a detox flare. And what this essentially feels like for some is that all of their breast implant illness symptoms came back. And so this can, cause some kind of worry oh my gosh, did I explant for no reason? Because I feel exactly like I felt when I had the implants in and I explanted and I thought I should be getting better, but now I'm experiencing all of these symptoms again. Was this a huge mistake? It's gonna take some time to really understand if this is a detox flare. And so if it lasts anywhere from 4 days to 2 weeks and even up to a month and then everything goes away, most likely that was a detox flare. It's honestly very rare that I hear about a woman who explanted and none of their symptoms went away after their explant. Now this can be different for those who have the MTHFR gene mutation or autoimmune issues, or just maybe having some mental health challenges like anxiety and depression and everything like that. From what I've seen, those women who have those 3 things do have a more challenging time after their explant, fully healing and recovering and getting relief from all of their symptoms, because they are dealing with those things like the autoimmune, the MTHFR gene mutation, which just, if you have that gene mutation, you have a harder time eliminating toxins from your body. So your body has a harder time processing them and then eliminating them, which can obviously make detoxing after your explant a little bit more challenging. So as always, I ask the question inside of my group, about detox flares and when they happened and what kind of symptoms they experienced when they had a detox flare. And some women said, and I can actually relate to this, their detox flare symptoms came before their period. So maybe hormones have some kind of play and role into these symptoms happening, because I know I can feel definitely more run down and irritable and everything like that before my periods. So, after you explant and you feel like your period's coming, just maybe be a little bit more on guard and more gentle with yourself, knowing, okay, I might possibly have a detox flare kick in. I have some techniques that I'm going to go through here in a second of what I recommend doing if you are going through a detox flare. And some common symptoms of experiencing a detox flare, and there's a handful, and I don't want to miss any of them, so I have them written down right here. But fatigue is a big one. So you just have that fatigue again. You kind of feel mopey and unmotivated when you're going through a detox flare. And that's just because your body has toxins going through it and it's doing a lot and it's trying to cleanse you and everything like that. And it can just make you feel a little bit run down. So if you're feeling a little bit more fatigued, 4 months, 5 months, 6 months after your explant, it's totally normal. I think for the most part, all of us experience some kind of wave, up and down, where we feel really good for a few weeks, a few months, and then we have this dip, this low of just feeling run down. It's just the best way I can put it. Brain fog is also another common detox flare after explant surgery. Joint pain coming back, just feeling really irritable and moody and edgy, having headaches, which is a classic symptom when you're detoxing or going through a detox. having trouble sleeping, so just maybe waking up a lot more throughout the night, not feeling rested in the morning, stuff like that. Having some kind of anxiety and depression symptoms coming back, being really anxious, just feeling sad, emotional. Those are all, everything that I'm about to mention here, they're so common and they're so normal after explant surgery. So I know it can be scary and you can question and doubt yourself, like, did I do the right thing? But I want to let you know, like, I've gone through everything that I'm talking about in this video, and so have a lot of other women. Some women experience rashes, maybe on their face, maybe on their body, but they do break out in rashes. Body odor, which is another classic detox symptom, your body just getting rid of whatever it is, heavy metals, chemicals, silicone. Some women claim that their armpits smell like silicone, so I can actually relate to that as well. And then, just having like flu-like symptoms. Again, just feeling overall not well, run down, emotional, irritable, tired, all of that. If these symptoms do last for months on end after your explant surgery, I would definitely recommend going to a doctor, getting maybe your hormones checked, maybe getting your thyroid checked, and then your basic like liver function, kidney function, getting all of those things just checked to see where your levels are at, even getting your heavy metals checked. I would definitely support your gut and support your immune system anytime before or after your explant, whether you have breast implants or not. Gut support and immune system boosting is just so important right now, especially in this time and age. There are 6 things that I recommend women doing after their explant if they are going through a detox flare. The first thing is to get up and move your body in some way, shape, or form. Even if it's just, going on a rebounder for 5 minutes, going for just a light walk outside around your neighborhood, dancing, just something to get up and move your body, get that stagnant energy going, because when we do move our body and when we exercise, we just have the dopamine and the serotonin and the feel good hormones running through us. So it can lift your mood, and it's overall just really good for your body, and good, especially if you're having fatigue. I know it seems counterintuitive, like I'm tired, so why would I exercise? But exercise actually helps to improve your energy. So it doesn't have to be anything strenuous, especially if you are experiencing like massive fatigue or any kind of joint pain or anything like that. But I definitely would recommend in some way moving your body. Second thing is self-care. And I'm not going to get too much into this, but whatever self-care means to you. During the detox flare, again, we can have that doubt and we can feel sad. And so it's a really important time to double down on your self-care and just pour into you, whatever that looks like. So for some people, it might be getting out of the house, and for some people, it might just be resting and staying inside of the house. Getting pretty, painting your nails, maybe putting on a little bit of makeup, drawing, reading, whatever self-care practices work for you. Double down on those when you're going through a detox flare. The third thing is to hydrate. So just hydrate, drink a lot of water, because if your body is going through a detox, you are going to want to make sure that you are hydrated and you are helping your body to flush out those toxins. The fourth thing is to take some binders. And I talk about this in a video I did a few weeks ago about how to detox properly after explanting, but you'll want to take a binder because if you are having toxins circulating throughout your body, you do want to take something that's going to bind to those toxins and pull them out of your body. So for instance, zeolites, activated charcoal, bentonite clay, doing some kind of detox smoothie from like the medical medium. Those are all some really good things that you can do when you're going through a detox flare, just to help your body out a little bit more and pull those toxins out. Number 5 is rest. So whether you're healing or you're going through a detox flare, your body's going to require a lot of energy. And so you want to conserve a lot of energy and allow your body to use that energy towards healing and recovery and repairing and detoxing you. So as much as you can, I know we all have a massive amount of responsibilities and it's the holiday season and everything like that, but just as much as you can, relax, unwind, and get in as much rest as you can. And then the last thing, number 6, is ask for help. Get support. especially if you're really run down and you have kids or a lot of responsibilities or obligations or anything like that, ask for help. It could even be inside of Facebook groups if you're just looking for encouragement, or, if you're not married, see if, a friend could help you or your parents can help you. If you are married, ask your husband for extra support. Just let him know how you're feeling. And just don't feel, I would recommend to not feel so pressured to just get everything done and, have the house clean and your work done and your kids' homework done. And like, we can put so much pressure on ourselves, right? So just allow yourself to have some grace with, like, if things kind of slip and slide and, aren't as perfect around this time, that you're going through a detox flare, just to give yourself that grace and tell yourself, you know what, I'm just not feeling good right now. I'm going to pour into myself and I can get to these things later. If you're looking for just extra advice or anything about detox flares, you can go inside of probably any Facebook group, especially mine, and just put in the search bar like detox flare. And anybody who's ever created a post with the words detox flare in it, like, those posts will pop up and you'll be able to read the post and also read the comments under the post. And you can do this inside of any Facebook group. Just go to the search bar, put in something you're looking for, and then every post that's ever been made will pop up. I hope that this helped you. Detox flares are really normal. They're very common. They, can last anywhere from 4 days to 2 weeks up to a month. And so during this time, just really pour into yourself and, don't question your body. Just trust her and believe her that she's doing everything that she can to heal you and get you back on your feet and feeling better. So I will see you on the next video. If you have any questions about what you're going through, and even if you feel like, okay, I just watched this, but is this normal? Is this normal? Let me know. I'm here for you always, whether it's under this YouTube video or inside of my group or on Facebook, or you can message me on Instagram. There's a lot of different ways that you can reach out to me, and I love to be able to help you in any way that I can. So if you liked this content, if you love my channel, then please consider subscribing and sharing any of my videos anywhere you see fit on social media.